ma'am, after doing surgeries, you use implants or body tissues. So, which one do you recommend? And when you recommend?
Regarding for the
Surgery.
augmentation, right? So again, that is the patient's choice. So some people, they want a slightly bigger size breast. In that case, usually we advise them to go in for implants. Yeah. For the autologous tissue, we normally use fat, which is harvested from either the abdomen or the thighs. And that fat is processed and it is injected into the breast size. But the thing is that with fat transfer, the size increase may not be as much as what we can give with an implant. That is number one. Number two, very often these girls do not have that much of fat in the abdomen or in the thighs because they may be very thin built. So in those cases, we cannot use the autologous fat. In those cases, we are compelled to go for implants. But if the lady has adequate fat reserves and she does not want to use implants, in that case, we can use fat from the various other parts of the body. We can suck it through liposuction and inject it into the breast to increase the size of the breast.
Autologous surgeries and implant.
Yes.
Which one is the good?
Again,
as per the body.
As per the body. So both are safe. As I told you, the indications for both are different. So if there is a girl who desperately wants her breast size to increase, but she does not have any autologous tissue, we'll be forced to use implants. Implants these days are all safe implants. We use all FDA approved implants. So the safety wise, both are safe. The only issue with autologous is that we may need more sittings as compared to implants. Implants is done in one sitting. In autologous fat, when we use fat injections for the breast, because it is autologous tissue, a part of it gets absorbed and the breast size that we have given immediately after the surgery may reduce to a certain extent. So it may need a second sitting to again bring that size back. So that whenever we decide what surgery is to be undertaken, it is always in counseling with the patient, with her parents, with her family. Very often I counsel them at least 4 to 5 times before they go in for the surgery, and only after I have understood what they want and they have understood what I'm trying to tell them, only then we decide to go in for the surgery.
When you are going for a silicone implant, what are the disadvantages and what are harmful things implant does?
So as I said earlier also, these implants are very safe. They are all FDA approved. So we don't really see too many complications with this, but they are foreign tissues. So sometimes there may be very negligible complications like maybe an infection here and there, or sometimes there may be some tightness around the implants. So these are very, very rare complications that we see once in a while.
Ma'am, after the surgeries, do the breast looks natural or normal, or any kind of like small or big, something like that?
No.
Sizes?
So once the surgery is done, initially about a month or so, it does look a little different from a normal breast. But as the tissue settles, the implant will settle down in its normal anatomical position, and gradually the breast starts looking and feeling like a natural breast.
Is there
Yes.
any scar after surgery?
The scars are there. There is obviously a scar because we need to cut the skin to insert the implant, but that is almost invisible because we usually put the incision in where the skin creases. So it gets hidden in that skin crease. And over a period of time, you can't really see the scar.
Suppose after the surgery, if there will be any kind of breast problems when the woman or child or girls goes to doctor for the breast examination or any kind of evaluations, so will it create any problems?
No, it does not. Because you have to understand that when we put the implant, we don't really put it inside the breast tissue. It is always put behind the breast tissue.
behind the
behind the breast tissue.
Okay.
So it is usually put just above the muscle. So between the breast and the muscle, that is where the implant sits.
Okay.
So any kind of breast examination or ultrasound is not interfered by an implant.
Okay.
So any future, like any detection of any lumps or
Mhm.
God forbid any cancers and all that is not really affected by breast implants.
Suppose a girl does the breast augmentation surgery before marriage and after marriage, after baby, breastfeeding is any kind of hindrance in the breastfeeding, or it's
No, that also is not affected because, as I said, it is behind the breast, so the breastfeeding can be taken normally.
Okay.
Usually, there is no interference with breastfeeding either.
Madam, this is the part where breast surgery is needed. Are there any kind of non-surgical way of treatment?
So, yes, like if there are certain very small augmentations that are required, there is what we have called as breast fillers. So, we can use that. It's a office procedure with no downtime. We can use fillers for increasing the size.
Breast filler is different. Breast silicone implant
Is different, yeah. But this is like for very, very small, deformities. It cannot really increase the size of the breast. So certain irregularities or something, if they are there, then these breast fillers can be used.
Ma'am, after implants, how many years it lasts? And is there any surgery needed in future?
So usually these breast implants, they can be left lifelong. Usually there is no issues whatsoever unless the girl or the lady decides to have them removed. Okay. Some people do come back after many years saying that, okay, we don't want these implants, so please remove them. Or they may want them to be exchanged. Suppose they have gotten a certain size and they want the size to be increased. Okay. So in that case, sometimes they come back that please change the size of these implants. I want them slightly bigger. Okay. Very rarely, as I told you, there may be some tightness around the implant. In those cases, we may have to remove the implant and put in a fresh implant. Okay. But otherwise, if it is there, they can stay for life. There is no need to remove them, or any further surgery is not required.